When I would develop really severe problems with my sinuses, it would put me to bed. My name's Dorothy Huggins. I grew up in Beaufort, South Carolina. I have been working as an obstetrical nurse until about 2 years ago when I retired. I enjoy traveling and antiquing. Started collecting brides and grooms' cake toppers, collecting the old photographs of brides and grooms. I started having problems with my sinuses about 38 years ago. The first episode felt like I had abscess teeth, and I went to the dentist who said no, that I had infected sinuses. I had to be hospitalized at that point, so that's when it started, and I've dealt with it ever since. I have had 5 sinus surgeries, and the problem just continued. I had a horrible time with nasal congestion. I couldn't smell anything. I just couldn't breathe. Because I was having so many problems in the antibiotics, I was taking round after round. My sinus surgeon suggested trying the SINUVA implant, and I was happy to give it a try. The procedure was done in the doctor's office. The doctor explained the procedure, used topical anesthetic to numb the area where he was going to be inserting the implant. Didn't take long. There was pressure, but no discomfort. And once the implant was in place, I couldn't even feel it. Instead of taking oral steroids, the medication was put where the problem is. The congestion started to dissipate, and I was able to breathe through my nose, which had been very hard to do prior to that. I didn't realize until after I had the SINUVA implant, I had lost my sense of smell to a certain degree, and now, since I've had SINUVA implants inserted, I have felt wonderful. I can smell fall. I can smell flowers. I'm just able to get outside and enjoy life. I have enjoyed feeling good.
SINUVA should not be used if you have a hypersensitivity to mometasone furoate or other ingredients in SINUVA, or if you have nasal ulcers or nasal trauma. The area where SINUVA is placed should be monitored by a physician for bleeding, irritation, infection, or perforation. Close monitoring by a physician is recommended for people with a change of vision or a history of increased intraocular pressure, glaucoma, and/or cataracts. SINUVA should be used with caution if you have existing tuberculosis, fungal, bacterial, viral, or parasitic infection, or ocular herpes simplex because of the potential for worsening of these infections. The most common adverse reactions in clinical trials were bronchitis, upper respiratory or middle ear infection, headache, lightheadedness, asthma, and nosebleed.
Please consider having the implants inserted because it made a huge difference in my life.